Been together so long we can't pretend. Remember the way we used to move, dance all night like young lovers do. Your heart is changing. Now we don't dance like we used to. Silent disco on the floor, baby. Mr. DJ, he'll get me through. When the beat's gone, you can't save me, baby.
This is Broad Radio. For you, by you. Broad Radio. Here for more.
Hello and welcome to Broad Radio. My name's Jo Stanley and my co-host today is Shelley Ware, who I adore. Hello, Shelley.
Hello, how are you this fine morning?
Oh, it's so nice to see you 2 days in a row. What bliss
I
this
know,
is.
bonus.
I know. So yesterday we had a little glitch, a little technology problem, which happens. I mean, I can't believe it hasn't happened more for us, to be honest. And it's meant that we've come back for a special edition to talk all about menopause with the wonderful Dr. Rosie Worsley, who's joining us just after this. Broad Radio is proudly supported by Chemist Warehouse. Chemist Warehouse, great savings every day. So here she is, Dr. Rosie Worsley. She was there on the screen yesterday morning when we were going to speak about... there you are. But we did have a little audio issue and we couldn't hear you, so you very kindly have returned the next day to join us to speak all about menopause. I want to say thank you so much to everyone who joined us yesterday on Broad Radio, and I apologise if you tuned in specifically to get all the knowledge that you need around menopause and perimenopause. And I hope that you've been able to join us again today. If you are watching live on Facebook or YouTube, we invite you to share your comments or questions and we'll endeavour to get those included in our conversation today. So Dr. Rosie Worsley joins us via Jean Hales for Women's Health. We do thank them for their assistance in giving us access to you, Rosie. You're an endocrinologist and a specialist in women's health. So I guess my first question to you, Rosie, is, I don't know. All right. So there's been so many, I don't even know where to begin. So what symptoms do we experience when we're in perimenopause? Because I reckon one of the biggest issues is for women, and we don't even know when it's coming upon us.
Yeah, thanks for having me, Jo. It's great to be here. And it's really great to be doing shows like this because it really is something that we don't talk about enough and something that a lot of women don't know about, and they don't expect it, and they also get a bit of a shock when it comes on, and they're not really sure what to expect because it can be a whole range of different things. And the typical one you think about is hot flushes and night sweats, but it can be a whole lot of other symptoms as well. And sometimes those symptoms might start before they're getting hot flushes, or sometimes they're getting hot flushes, but they're not sure if the other symptoms are related. So basically pick any part of your body and menopause will affect that. So it's not just hot flushes and night sweats. It might be things like feeling irritable. So it's kind of like a super PMS that some people get. They might have aches and pains. They might have things like vaginal dryness. There's a whole lot of things that can go on. Fatigue, of course, is the other really big one, and sleep disturbance. So basically pretty much anything can be related to menopause, and that's why it can be a bit of a shock when it happens and why it can be difficult always to work out what's going on.
So can you just explain to us what perimenopause is and menopause? What's the difference?
So the word menopause technically means the actual last period that you have, but you don't really know it's your last period until you haven't had a period for a year. So perimenopause is the term that describes the year before your last period and the year after your last period. And that time frame is when symptoms tend to be the worst, and often when they start as well. So it's really that sort of 2-year menopause transition is the other term that's used.
But it does feel like it goes on forever. Like, when would you expect perimenopause to begin and for full-blown menopause to sort of to arrive? I mean, it just feels like it just is an endless blancmange of experience.
Yeah, it's very individual. So the average age of onset of perimenopause is about 47. And perimenopause is defined as basically when your periods start varying by a week or more. And then the average age of your final period is 51.
Oh.
But the average length of duration of hot flashes is 7 years. So we're talking about a long process. And for some women, they're still flushing well into their 70s. So for some women, it's short. They don't really get symptoms. For other women, it's just sort of this prolonged, ongoing process. So it's very individual. We don't really have any good tests that will tell you, your last period's coming up this year. There's nothing to guide you that way. Often the best guide is what happened to your mother. But if you don't know what happened to your mother, that's a bit of an issue.
It's a bit of a mixed bag in our house. My grandmother was 40, and I think my mum was about 50. And then I went to the doctor, and the doctor said, "Oh, you're years away from it." And then they got the nice, "Oh, don't worry, you won't get any wrinkles." So I've got no gauge on that, when it's going to happen. Makes it quite difficult. Is it true that if you still have lots of eggs that menopause is a long way away?
Generally speaking, so if you've got, you mean on an ultrasound scan, if they can see a lot of follicles on an ultrasound scan, then, generally you would expect that menopause is a ways off, but that's not 100% either. So there's not been any particular test that's been entirely predictive of when your last period's going to happen.
So you mentioned every part of our body is affected, and we've got lots of questions from people on Facebook, and we're going to have a caller join us in just a moment who has a question as well. I suppose people want to know how to help themselves, and one of the insights I've had through all of the comments we've had on Facebook is that women go to their GPs and to doctors and ask questions, and they get dismissed. They get a really unhelpful response usually. Tony says there's a lack of empathy, understanding, definitive answers, and most doctors just, don't really care. Do you think that's a common experience? And what do we do then? Who do we go to seek help from?
Oh, look, I think it is unfortunately a common experience, and I think it's because medicine reflects the rest of society. So if we undervalue women and women's experience, then what are we going to expect out of our medical system or our health system as well? Luckily, there are quite a few really good resources. So Jean Hales has a really good website, and the other very good resource is the Australasian Menopause Society at menopause.org.au. So if you go on there, there's lots and lots of information, but there's also a Find a Doctor function, and that will include a list of doctors who specialise in this area and who understand women's health.
So Dr. Rosie, what treatments and therapies are actually available to women?
Look, there's a whole range of options. For some people, they don't need treatment, they need an explanation. And if they know what's going on, then they can manage it. And sometimes it's the uncertainty of, well, why is this happening? Am I going crazy? And once you can say, oh, look, it's your hormones, then, they feel comfortable with that. Some people will be able to, use techniques like some lifestyle change, so making sure they're getting plenty of rest and enough sleep and doing some exercise and some relaxation, that kind of thing, all the usual. For other people, they might try some natural type therapies, and some of those herbal remedies do seem to help. For people who that doesn't work, then hormone replacement therapy, or menopausal hormone therapy is the other term, is extremely effective. And it's very safe for most women, but again, it depends on your individual circumstance.
So that leads me to some more specific questions from some of our listeners on social media. Naomi puts it this way: she would like accurate, science-based, factual information on, it's called MHT now, isn't it? Not HRT. But actual science-based information, because I think the problem around that conversation is you hear a lot of scary things and you don't know what to believe.
Yeah, it's been one of the major issues with menopausal hormone therapy, not only for consumers and patients, but also for doctors as well. So in 2002, there was a very large study published that showed a link between hormone therapy and breast cancer. And that basically scared, the SHIT out of all the doctors.
We don't care
and
about language here. We're all for language, Rosie.
Yeah. Then you had a whole generation of doctors who didn't get taught how to do hormone therapy. So the evidence now is much better, but there's been so many studies, so many analyses and reanalyses. It's very confusing even for doctors. And so you do need to go to sort of the expert places to get a real distillation of what's available. And I think the Menopause Society has very good fact sheets, both for medical people and also for patients. And Jean Hales has really good information as well. And all of that is, scientifically based and accurate. And I think the other thing is so much of the health information on the internet is geared towards selling you products. So you have to be very discerning about what information you look at online.
So, but just to clarify, if I'm going to be taking MHT, it's not going to give me cancer.
I don't think we can say there's no link. There is a link between MHT and cancer, between MHT and breast cancer. So we still have to go by the old stats, which is that MHT, 5 years of continuous use of MHT will increase your baseline risk of breast cancer by about 30%. So if your 5-year risk of breast cancer is, say, 6%, it might go up to 8%. Now, that's after 5 years of risk. We know that 1 year of use has no effect, and then between 1 and 4 years, well, some studies say there's no risk, some studies say there is. The stats are based on the old forms of HRT, on the randomised controlled trials of the older synthetic forms of HRT. We've now got more modern HRT, which is, we think, a lot lower risk, but we don't have the huge scale studies to say that. We've got large observational studies which show that they do seem to be safer, but they're not randomised controlled trials, so they're not considered as high quality evidence. So you certainly do have to weigh up risks and benefits, and it depends on your individual risks for things like breast cancer, and then you've got to weigh it against the benefits. So what's the benefits to you for your symptoms? And the fact that it will reduce things like the risk of osteoporotic fractures, the risk of colon cancer, the risk of endometrial cancer. So in some cases, it's 6 of one and half a dozen of the other. And when you look at, it's a very gross measurement, when you look at mortality outcomes for HRT, there's basically no difference. So, it's very much an individual scenario, which is why it's not a straightforward issue and why it takes a lot of time. And the system, our current system, is not really set up, to allow people to go to someone who knows about HRT and spend 45 minutes discussing their individual risk profile.
Which is, well, we might get to that question in just a moment, but firstly, we have got a caller on the line. Linda is here, and I'm testing my I can't even say it. Multitasking. You see, I've got brain fog and I lose words all the time, Rosie. I'm going to pick up the phone here and we're going to say, good morning. Linda, how are you?
Good morning, Jo. I'm well, thank you. How are you?
Yeah, very well. Thanks for joining us on Broad Radio. You've got a question for Dr. Rosie.
I have, yes. Hi, Rosie. How are you?
Yeah, good, thanks.
That's good. I would like to know, I'm trying to use as many natural remedies as I can to help alleviate some of the, symptoms of perimenopause. What I'd like, and I'm using, I have a herbal tea every day of lemongrass and ginger to help with the hot flushes, which does help, and I go for a walk every day. But what I'd like some help with is migraines or severe headaches and just brain fog. I really struggle with that, and it happens a lot.
Yeah, that's a really good question because they're very common symptoms. So a lot of women don't realise that migraine in particular is very common with perimenopause and menopause, and that, you know, often women have had menstrual migraine when they were younger. Sometimes they've not had migraine at all. And then essentially the changing hormone levels act as a trigger to migraine. So if you're trying to use sort of non-pharmacological treatments, often a bit of magnesium is actually quite helpful. So a high-dose magnesium supplement does have some evidence of benefit for menstrual migraine. So I would look at that. Migraine can be very debilitating though. So I think if that's not working and you're not identifying other triggers that you can easily get rid of, if you can either go down the hormone therapy approach, which is very good for migraine around menopause, or you can look at medications that actually treat and prevent migraine. So you've got drugs that you can take at the time of the migraine. So these are things like wafers or nasal sprays, which can basically cut the migraine short. So if you're already treating your migraine with, say, Panadol and aspirin and that's not working, you can use these other types of medications. And then there are other non-hormonal medications that you can take every day to prevent migraine. I think it's certainly worth treating migraine fairly aggressively in terms of preventing it because, you know, migraine is, apart from being debilitating, often it's a fairly prolonged experience as well, in that you might have what we call a prodrome, so you can feel unwell for quite a while before the actual headache hits, and then people seem to have this hangover afterwards. And all of that seems to really make the brain fog associated with menopause a lot worse as well. And brain fog can be part of that kind of hangover from the migraine. So I would think if you can get on top of the migraine, that may well help with the brain fog. You may find the magnesium helps a bit with brain fog as well. And then really the things that help with brain fog, apart from getting adequate sleep and cutting down your alcohol and things like that, estrogen therapy basically helps brain fog.
So Linda, can you describe the brain fog for us? Because it's such a vague term. And it's, again, one of those symptoms that you go, well, I might just be someone who is struggling to concentrate today. How do you describe the brain fog?
For me, it's just, I can just be in a meeting or in the middle of a conversation and I completely lose all train of thought. I lose the words that I was going to use. It's really awful because you just sort of, they're like a deer caught in the headlights and you're thinking, oh, these people must think I'm a complete idiot. But and it's really horrible. I was talking to a girlfriend the other day and I just stopped and she said, are you okay? And I said, I've forgotten what I was about to say to you. And we laughed about it, but I'm thinking, well, in a meeting, that's not exactly productive.
No.
But, so it's just awful.
I think too. I mean, this is where all of that kind of that old tired trope of women being crazy, particularly older women, and being a little bit, you know, oh, you're losing your marbles and all that sort of stuff. That's, I suppose, where it comes from.
Yeah, quite possibly. I think people just think, you know, oh, she's not concentrating or she's not prepared, and it's not that at all. I've got notes, I've got, you know, to prompt me, to remind me of the things that I'm going to ask in that meeting, but it's just really awful. So luckily, most people have been very understanding, but it really is a horrible feeling.
So estrogen, you say, Rosie?
Yeah, estrogen often is very effective, and I think it's a real problem. Some people have very debilitating brain fog, and it usually goes along with other symptoms as well. So it's not uncommon for me to see women who've either have given up working or cut down their hours very substantially. So it's a really awful thing because, you know, late 40s, early 50s is when careers are often starting to take off, and it can really just sort of knock their career out completely. So, you know, for people that are really struggling with it, I tend to just recommend HRT. I think the other thing is that often when people do have these symptoms, it's then very hard to not let anxiety about the symptom get out of control as well.
Oh, wow. Well, Linda, we're thinking of you. You're not alone, okay?
Thank you.
Thank you so much for joining us on Broad Radio. So, Shelley, you had a really important question around heart health.
Yes, I was just asking about bone health and heart. How do we, I know that it affects our bone and our heart health. How do we prevent any effects on our bones and heart?
So we know that after menopause, so basically within that first year after your last period, you start losing bone density straight away. I mean, really with bones, you hit your best bone density at 25 and then it's all downhill from there. But after menopause, it gets worse and you get these sudden drops. So what estrogen does is it helps maintain your bone density. And then once you stop HRT, you will find that the bone density decreases from then, but you've delayed the point at which your bone density will start to decline. In terms of your heart health, I think the evidence is less robust, but it is fairly good evidence that if you're using HRT within 10 years of your last period, that is probably beneficial for your heart. We don't use it as a way to protect you or prevent cardiovascular disease, but it's probably beneficial if anything. The main things really that are helpful for heart health are things like making sure you're not smoking, so quitting smoking if you can, not having too much alcohol, eating your vegetables, doing your exercise, all of those things, getting your GP to check your blood pressure and your cholesterol and paying attention to all of those risk factors.
I've got a couple of really quick questions from social media for you, Rosie. First is Tina asks how to stop the weight gain. Is that even possible?
Not really. It's really difficult.
It's heartbreaking.
Yeah. Look, there are some people who are very lucky and they don't seem to gain weight around this time, but I don't think there's many of them. I like to think of it as sort of transitioning to a more energy efficient phase of your life, that you're going, maybe to a 9-star energy rating, that sort of thing. But it's very difficult, and people often find they have to cut their calories a lot more than they did in the past. And what a lot of women will say to me is that, all the strategies they used to use to control their weight don't seem to work anymore. And they're as busy as they ever were. They're doing as much exercise. They're still working really hard. They're eating the same, but the weight's going on. And we don't have any good solutions around that. HRT, although it can prevent that redistribution of weight that you get at menopause, where basically fat goes to your tummy instead of your thighs, it can slow that, but it really doesn't seem to do much in terms of weight overall.
That's really bad news.
But does it go away? Does it go away after you've actually finished your perimenopause?
No, basically you're just transitioning to a lower calorie requirement phase of your life.
Oh, that's...
no, it gets worse, basically.
We're transitioning into having to be more control with what our eating. That is no fun, because when you're going through the symptoms, all I want to eat is dark chocolate, basically.
Of course.
Yeah. So
absolutely.
This is not good news. Okay. Kerry is asking about CBD oil. She's taking that and she finds it really helpful.
Yeah, I think we don't really know, to be honest. There's no sort of studies that I'm aware of. I think CBD oil is something that's only just become available in Australia. So certainly I don't have any experience with it. I've certainly had a few patients who've used it for various things and found it helpful, but we don't know one way or the other if it's any good for, say, hot flushes.
Okay, and Mandy is asking, she's seeing a naturopath and she wants to know if that's worthwhile to go down that path.
I think that there's some evidence for a few things. So we know things like black cohosh and red clover might have an effect for some people. Often it's short-lived, but sometimes you only need a few months of benefit. I think it depends what they're looking at. So if they're just trying to sell you hundreds of dollars worth of supplements, maybe think twice about it. But a lot of naturopaths sort of focus on fairly sensible kind of strategies to do with sleep and exercise and getting more vegetables and things like that, and that sort of thing's always worthwhile.
I don't know if you're the same, Shelley, but I do get so much advertising on social media for every single fad possible for menopause, which initially I was very offended by. But I assume most of it is just trying to sell us something and it's not necessarily going to work, Rosie.
That's right. It's mostly marketing.
Yeah, okay. All right, a couple more questions. Go, Shell, you go.
I was going to ask a question about if a woman has had a hysterectomy. How do they know they're going through perimenopause and menopause?
Such a good question. And you really don't know, because the diagnosis is based on bleeding pattern. The only way you tell is through symptoms. And then when you get symptoms, you can have a blood test that can give you an indication. the difficulty with perimenopause is that the blood test sometimes will not reflect the fact that you're perimenopause. But basically, if you're over 40 and getting hot flushes, you're very likely to have perimenopause.
And from Jill on Facebook, what is estrogen dominance?
Essentially, it's a made-up term, so it's not a medical term. It's something that is used by naturopaths and things, and it seems to refer to a variety of different things. I think often people are using it to describe estrogen-related symptoms. So we know things like breast tenderness is common if you say you're on estrogen therapy or you're at a time in your cycle when you've got a lot of estrogen. But estrogen dominance per se isn't a thing. Certainly you can have times when, so perimenopause is very complicated hormone-wise because it's not that your hormones are just dropping, it's that your estrogen levels are going up and down. They're fluctuating quite rapidly. And you can have things like double ovulation. So you certainly can have very high estrogen levels and then have symptoms like breast tenderness. It's pretty common at perimenopause. And then at other times, because you're not ovulating, you've actually got higher amounts of estrogen relative to progesterone compared to when you're premenopausal. But I think the term estrogen dominance is pretty confusing because I think different people use it in different ways. So it's hard to know what they're talking about, honestly, and it's better just to describe, well, what is the symptom and what can we do about it?
Well, the key to this conversation is seek really great advice with an expert such as yourself, Rosie. There's lots of amazing endocrinologists and people who are expert in this field out there, so we need to seek that, and those websites were really helpful. Of course, go to Jean Hales for women's health. But there are many comments on our Facebook at the moment around the fact that people have sought help. They've sought advice and not found it. And Michelle is asking, why is there such a lack of information from the medical profession around menopause and women's health in general? And do you find that a frustration yourself, Rosie, as someone who works for women's health?
Yeah, look, I call women's health the black hole of medicine because there's just so much information missing. And where you expect to see like the dazzling stars of research, there's just nothing. And there's many women's health issues that are very common that are experienced by a huge proportion of women that we know nothing about. There's very little information on it. So, if you think it can be things like, so I do a lot of premenstrual dysphoric disorder. Very little on that. Menopause, really quite limited options there. Think about things like pelvic instability in pregnancy. Basically, we know nothing about that. Do we have any treatments? How many women still have it after pregnancy? I think it's relatively common, but we know nothing there. So there's a huge range of things that are very common symptoms that are not sort of considered illnesses and that are not researched, and they're not, because it's thought, well, they don't kill you. It's very hard to get funding for anything or get anyone interested in them. So it is difficult, and it becomes frustrating because you can't always give people great answers. And then because you can't give the answers and there's big gaps in information, that's where you get people coming in who just make stuff up and try to sell things. And then it becomes even more confusing.
Also, there's this sense of there being a stigma, I suppose, and I'm testament to that because I went through menopause sort of around 40, very early, and for a long time, or in fact, I've never really spoken about it because I've been really kind of embarrassed and a bit, it felt to me like I was losing a sense of my womanhood. Do you think that's a common experience for women to go, ugh, I don't want to actually even acknowledge this is happening because who even am I now?
Yeah, look, a lot of women do. And, I've had people that don't even want to tell their own family that they're having menopause. But really, 10% of women go through menopause before 45, 1% of women before age 40. And when I was going through medical school, we were told, early menopause before 40 is really rare. It's 1%. But when you think about it, 1 in 100 women, that's actually very common. That's a lot of women, so there's a lot of women who are having this experience. And I think, we do need to kind of change the way we think about it, in that it's often tied with, well, either womanliness or sexuality or being able to reproduce. And I think because we've still got that sort of cultural hangover of, the main use of a woman is to have babies. She's a walking uterus or something rather than a person with a uterus. So, I think if we can reframe that and it's just part of female existence, then that might be helpful.
I agree. What would be your one takeaway for our listeners on perimenopause and menopause today?
I think that it is very individual, and that for some women, it's completely fine. It's not a big deal for them. But there are women out there for whom it is really quite debilitating and devastating, and we need to recognise that and have some compassion for that, and try and get them help where possible.
I mean, again, Tony on Facebook, she says, we still have to work, function, put on a brave front while silently dealing with mental, emotional and physical issues. That feels like a very distinctly female experience.
Yeah, look, many of the women I see, they're doing more than is really humanly possible. I mean, they're being asked to do so many different things in so many roles, and then you add menopause on top of it, and it's like the straw that breaks the camel's back. And it's just another factor that really starts disadvantaging women. If you have to give up work early or start cutting down your hours because of, what is essentially a really common experience in women's lives, because there isn't the available help or information available, then that has implications for the rest of your life and your income earning and all of that sort of thing as well.
Yeah, it's just shocks me and makes me so deeply sad. I have one more very quick question from Facebook. Kristen is asking, do you recommend any of the natural cream products for hormonal skin dryness?
No.
No. In a word, no. Don't go there, Kristen.
What can she do?
Well, I want to say thank you so much, Rosie, for your time this morning and for just the wealth of information that you bring. And also thank you so much to Jean Hales for Women's Health. What an extraordinary organisation Jean is. And you were telling us earlier that Jean Hales was the first person to open a menopause clinic in Australia in 1971, if I got my facts straight there.
Yeah, she was a GP and she set up the very first menopause clinic in Australia at Monash, and really a trailblazer. And I think we sort of forget how far things have come and how difficult that would have been, in the early 70s. So, she really was an incredible woman. And when she died, it was other clinicians that really admired and respected her so much. And of course, her family, as the Jean Hales Foundation is now run by her amazing daughter Janet. So, it's really done incredible work for women in Australia.
And Shelley, I know you're an ambassador for Jean Hales, so you're a big fan also.
I am a big fan of their work, and you can actually head to their website now and be a part of the Jean Hales Women's Health Week and host an event. So they should really check out that website. There's some amazing medical information about so many things that affect women.
Yes. So, Dr. Rosie, thank you so much for your time this morning. It's just been wonderful. I hope we get you back on soon because you're super inspiring and you bring you so much great information. And also, thank you so much to everyone who joined us in our conversation this morning on Facebook and YouTube, and for all of the questions and comments. I'm sorry we didn't get to all of them, but it's just been really, really critical conversation, and I've loved it. Thanks so much, Rosie.
Great, thank you. And I should have said, the treatment actually works and you can feel a lot better. That's probably the main takeaway.
Sorry, I lost the start of that comment there. Can you say that again?
Just that the treatment does actually work really well. So that's probably the main take home. You don't have to feel terrible.
We don't have to suffer. That's good news. And you know what? If you are putting on weight, reach for the chocolate anyway, because, really the process of aging is to just become friends with yourself regardless of how you look, don't you think?
Absolutely.
I would never give up. Yeah, I would never give up chocolate.
No, I never give up chocolate. All right. Well, thank you so much, Lady Shelley. It's been a delight to see you 2 days in a row. What a blessing for me.
Yes. Thank you so much for having me.
Yeah.
Thank you.
What a gorgeous time. And we will be back with Broad Radio on Tuesday next week. We'll see you then.